Everyone, it's Argonath here from The Right Way, and welcome to another episode. You might not have seen the slide that was posted on one of the websites somewhere. It's written by Dr John Gibson from the Waikato University. So if we go to the Waikato University page, so he's a professor of economics. He was previously taught at University of Canterbury and Williams College, was a research visitor at the Centre for Study of African Economies, University of Oxford, and is an associate researcher at the Lycos Centre for Institutions and Economic Performance. He's also got a PhD from Stanford University, so he seems like a pretty knowledgeable fellow and well qualified academic. So you might be wondering, well, why is an economist talking about COVID-19 deaths? Well, he's looked at the data and come up with some conclusions. I guess you can make your own mind up about those particular conclusions, but I think he's trying to make a case for the deaths that have occurred and what the economic damage that's going to happen to a particular country as well. He's not making a direct comparison, but he's looking at whether the deaths actually really saved people in the long run or not. So let me just make this a bit bigger. So the level 4 lockdown imposed in March 25, 2020 in New Zealand was the world's most restrictive set of closure and containment policies at the time. So we were really locked down in New Zealand, and because we're a little itty bitty island at the bottom of the world, and we've got a massive moat around our country, so we can basically stop people coming in, and it was pretty severe. So while designed to deal with the COVID-19, it was soon noted by public health academics that all-cause mortality fell below historical rates for about 5 weeks after the lockdown restrictions began. So that's basically mortality from all causes kind of fell. So deaths stayed below their week of the year averages for most of the next 4 months, avoiding the usual winter peak due especially to influenza. So basically from kind of March onwards, New Zealand's in winter, so that's our influenza season, and generally we have about 500 deaths to influenza every year before COVID-19. This effect has been dubbed a COVID-19 response-induced life gain. So we've gained life because people didn't die because of the flu and stuff. And some commentators argue that the tools used in 2020 against COVID could be used every year to deal with the winter peak in deaths due to influenza. So basically, hey, because of the flu, let's just lock down the whole country again into level 4, stuff everyone who has to actually earn money to pay for their mortgages and food and stuff like that. Or the government just gives out money. Where do they get the money from? From the taxpayers. Where do the taxpayers get money from? Well, they provide services and goods and get it off other people. If you're locked down, you can't actually do that. We can't borrow because we've already got a massive debt as it is. So some of these commentators are just out of their mind. You know, locking down the country every year for influenza is just something that we've dealt with for many, many years previously, and we will just have to do that as well. And eventually, it's going to become the same with COVID. So a cost-benefit analysis of this proposed recurring use of these public health interventions depends on how costly they are and how long the effects lasts. For cost, one key analysis suggests that an intervention to cut risk of COVID has a 95-to-1 ratio of cost to benefits. So 95 costs, 1 benefit. So not quite that great, right? In this study I examined the second question: how long was the postponement of deaths from interventions in 2020? So he talks about his data and methods, and if you scan the QR code up the top, that will actually take you to this particular research that he's done, so feel free to go through and look through that yourself. So the disaggregated data, so age disaggregated, so not lumping all the ages together. Weekly deaths for the New Zealand were obtained through the Human Mortality Database. So it just talks about how the results were garnered. what he took to take out any kind of variability and any possible errors and so on. So feel free to read through. You can always pause the recording and read through that if you really want to. So let's go to the second side and have a look at what he says from the results. So the weekly pattern of deaths in 2020-21 and the average number of deaths in the same weeks from 2011 to 2019 are shown in figure 1. So you can see the average is in red, and then the actual deaths in 2020 and 2021 is in black here. The number of deaths fell in late April, and by mid-May was below the average, so we can see the black line is below the red line now. So there's a sharp fall in the deaths because basically we were locked down, and then there was no flu to go around as well. Below average number of deaths persisted for the next 4 months, with almost 500 fewer deaths in this period than would be expected from the 2011 to 2019 average. So that's pretty good, right? We're saving 500 people from dying by being locked down. Note, however, that weekly deaths in this period were always in the range of individual year experiences. So the weekly deaths was within about the range that we would normally expect, just slightly lower. What was outside the range of prior experience was the surge in deaths starting in November and persisting past the end of February. So this was when I think we came out of lockdown. In this period, up to 100 more people died per week than would normally be expected from the historical patterns, totaling almost 1,200 excess deaths. So basically, you can see the surge here, right? After November, the surge in deaths became quite pronounced compared to the average. Right, so it went down during lockdown. Yay, great, awesome. Got out of lockdown, all the deaths went up by quite a huge margin there. Right, ironically, the surge is especially apparent from week 51 when The Lancet, I guess it's a medical publication, published a letter from New Zealand authors that suggested that any potential late adverse effects on mortality resulting from reduced access to healthcare during lockdowns have not become apparent. So they didn't take into it, so that was just as the surge was starting. Well, it became pretty apparent afterwards. So why is the surge? It's not because of COVID-19, because we had pretty much stamped it out by the end of lockdown. We were COVID-free in the community. But what probably happened is that people who needed to get access to medical care couldn't during lockdown unless it was an absolute emergency. So people like cancer patients, maybe people on kidney dialysis, things like that. Maybe they weren't able to go into hospital to get their treatment. And so basically it just postponed what's going to happen, and then they started dying, sadly, after we came out of lockdown. So the age disaggregated data show the surge in deaths from November onwards is concentrated amongst the elderly. So this is figure 2. So if we go to figure 2 here, you can see ages 0 to 64. The averages and the deaths are pretty close, although there is that surge in November over here. So that was between 100 and 150 deaths there. But if we look at the other side, for ages 65 years and above, we can see that in November there's a huge surge in deaths over the average, right? So a lot more than people less. So basically, evidently there is just a short postponement of death by about 4 months from strict containment and closure policies imposed to deal with COVID in 2020. So yes, we shifted the deaths from our winter period into November up to January, and unfortunately they died in that particular period. So we didn't really save too many people. We just kind of it's great we postponed it, but what effect has it had to our country? It's been pretty massive. So conclusions. The fall in all-causes mortality after lockdowns in 2020 is only a short-term effect. A winter of no excess mortality was followed by 4 months of excess mortality, totaling about 1,200 deaths. The surge in deaths was concentrated on the elderly, so public health interventions only slightly postponed death. Repeating COVID control message in future to deal with seasonal influenza may provide just short-term benefits only, and it could really ruin the country if we do it every year. So the people that are advocating shutting down our country for influenza, we just can't do that. Okay, and it doesn't actually save you much. Yes, people get a few more months of being alive, which is awesome for them, but we have to think of everyone, and eventually we're all going to die at some point anyway, right? So it's just something that we have to deal with, living with influenza, and I think COVID is becoming the same way as well. Alright, so I just thought I might bring this to your attention if you haven't seen this before. Hopefully you kind of understand what Dr. John Gibson has been talking about. To me, it kind of makes sense, seems logical, so I'm happy to go on with his findings and conclusions. Alright, that's it for this particular video. If you liked it, please click the thumbs up. Please click subscribe if you like my content, and it just helps with other people trying to find content from mine on the YouTube algorithm, so it will be greatly appreciated. Alright, hopefully I will see you in the next one.